Good morning, everyone. I'd like to call this informational meeting of the House Aging and Older Adult Services to order. Please bear with us while we're working out our technical difficulties. Everyone should know that this meeting is being recorded and members and guests should silence all cell phones and electronic devices. For attendance today, we'll just ask each committee member to present and introduce themselves by stating their name and their district they represent. We'll start down.
State Representative Shelby Labs, 143rd Legislative District, Bucks County.
State Representative Bridget Kozarowski, 114th, Lackawanna County.
State Representative Lindsay Powell, 21st District, Allegheny County.
Representative Melissa Serrato, the 151st District, Montgomery County.
Representative Jessica Benham, the 36th District in Allegheny County.
Representative Steve Menser, Lancaster County.
Representative Maureen Madden, Monroe County.
Representative Tara Khan, Philadelphia County.
Representative Brian Rosal, Westmoreland County, 56th District.
Brenda Pugh, 120th District, Luzerne County.
Representative Joanne Stair, the 107th.
John Schlegel, represent the 101st District in the heart of Lebanon County.
Thank you, everyone. Are we? Can the folks online hear us?
Yes, now we can.
Excellent. If you would mind introducing yourself, Representative Jones?
Thank you, Chairman. Yes, this is Mike Jones, 93rd District in York County.
This is Marla Brown, District 9, Lawrence County.
And we also have Representative Marcel online. Can you hear us? Okay. All right. Okay. Thank you again for your patience. Today we have the good fortune to hear presentations from the three very reputable leaders in the aging community. They will be providing us with a brief snapshot of what our local area agencies on aging do to protect our older adults, along with the current issues they are confronting on a daily basis. Our panel includes the board president of the Pennsylvania Association Area Agencies on Aging, commonly referred to as P4A. J.R. Reed also serves as the executive director of Lehigh County Office of Aging and Adult Services. With him is Beth Harold, who is the director of the Butler County Area on Aging and serves as the board vice president of P4A, and Rebecca May Cole, who serves as P4A's executive director. We are so happy that you are here to testify today. Before I turn it over to Chairman Menser for opening remarks, I would like to say we are grateful that you are here to talk about what is happening with our area on aging around the Commonwealth. We know that you are our first responders. You're the first line of communication for taking care of our seniors and seeing what they need. And we know how important your job is. And we want to make sure that we get you the resources and we understand exactly what it is you need. So thank you for being here today.
Yes, thank you, Chair Madden, for scheduling the informational meeting with $3.4 million aging adults in Pennsylvania, and that number growing. We appreciate you all coming here today and appearing, and I look forward to learning more about the services provided by local area agencies. Thank you.
Good morning. Thank you for the introduction. Are you able to hear me okay? Yes? Okay. I am thrilled to be here again, Rebecca May Cole with P4A. I've had the pleasure and honor of serving as P4A's executive director for almost 10 years now, so it has been a wonderful experience. I wanted to start out by talking a little bit about the way we talk about aging. If you watch the television, if you are on your phones, you see a lot of different advertisements about fighting aging, things that you can do to help with wrinkles and things, hormones and all kinds of different things, hurting your joints, hurting, all of that. There's a lot of negativity around aging. I want to say that we are all aging. Every single one of us is aging. My next birthday, I'm going to be 50. I am going to be half a century old. And I want to specifically mention that because of the fact that we tend to hide our age, especially women. And it's something to be proud of. We are all aging. We all stand on the shoulders of those who come before us, and our parents, our grandparents, their grandparents are the ones that brought us to where we are today. So I want to say that Pennsylvania is very fortunate to have the 3.2 million older adults in Pennsylvania. They are wonderful parts of our communities. They are wonderful contributors to our society, and the AAAs are very honored and proud to be able to serve the older adults in our communities. And just a little tidbit for you to know that if you have a positive view of aging, you actually have a statistical likelihood that you will live 7.5 years longer and healthier. It helps to decrease medical issues. It helps to decrease potential for dementia and many other good things. So if you have a good positive view of aging, it actually can help you yourself. So that said, a little closer. Oh, okay. You know what? I'll try to look. I'm looking to my sides for those of you. Sorry, I'll try to keep my head going forward. It's probably when I'm moving. So area agencies on aging, they are the ones that deliver services for older adults. They're the ones that people call first. They're the ones who were established in the Older Americans Act in 1973. We are fortunate we have 52 area agencies on aging in Pennsylvania, covering all 67 counties. And area agencies on aging, we will call them AAAs, just because it's a lot easier to say, provide a variety of options. Really, the intent is to keep people in their homes for as long as possible and safely in their homes for as long as possible, wanting to age in place. As I mentioned, we have 52 area agencies on aging. 33 of them are county-based AAAs. Actually, my colleagues here today are both county-based agencies. And then we have 19 AAAs who are also nonprofits. They have multiple different funding streams that they are able to pull together and braid and leverage to be able to serve people as much as possible and use a lot of volunteers. There's a significant number of volunteers that AAAs use. And again, the whole purpose of area agencies on aging is really to keep people in their homes. In your slides or in your packet, you have a map that shows the planning and service area. Basically, it's the catchment area for each area agency on aging. So you can see the groupings that we have. Some AAAs actually cover multiple counties. Others only have one county. It's slide number 5 if you're looking for it. And then the next slide, number 6, shows which AAAs are county-based and which AAAs are nonprofit. In case at some point in the future you're interested, you will have that. The AAA network actually contributes a lot to the economic engine of Pennsylvania as well. We employ more than 3,000 employees. We reach over 500,000 people annually. We have 20,000 plus years of experience working in the aging world, and we use 11,000 volunteers on a daily basis. The core values that AAAs have really is the focus on self-determination. It's on me making a decision for myself as I'm aging to be in the place where I want to be as much as possible. AAAs really are focusing on the whole person, not, and I'll say not just, I don't mean to minimize, but not only the health side or only your physical needs, but they really look at the whole person and really try to connect the dots, including mental wellness, including social needs. They, in many cases, are kind of the early warning system or early intervention for older adults. People will reach out to AAAs. AAAs go out and they notice things. The volunteers that they use notice things. And so they are really valuable as a way to prevent some negative things that can happen to older adults. They may be the first ones to notice that somebody may be declining and maybe needs a little bit of assistance. And we'll keep going. One more, actually 2 more slides for me. Information and assistance is usually the first way that people interact with the AAAs. The AAAs know what's happening in their communities. We're fortunate because of having 52, they know their communities very, very well. And so if you need to call them. If you have a constituent who reaches out to your home district office and needs assistance with an older relative, they are there to be able to provide that, those linkages between them and then the communities that, the resources that they have. And then again, they also have volunteer and community resources available to them. And I kind of covered this slide, AAAs, again, keeping people in the home, looking at the overall needs of a person to include medical service. They don't provide medical services, but they help with the transition home from a hospital. There's a lot of ways that AAAs are helpful for people in a variety of different ways. The next slide, and I'll point out this little guy that says, I need help. He'll be showing up a little bit later, so ask you to watch out for him. And again, AAAs really are the first people that older adults and family members will call. They know their communities best, and AAAs are your best resource. If you have issues with your constituents, they come to you and they need your help. Really call your local AAA and they will be able to assist you. Now I'm going to turn it over to Beth.
Good morning, everyone. My name is Beth Harold. Can you hear me okay? All right. I get the fun part. She had to go over statistics. I get to go over some of the fun services that we do. Just to give you a little bit of background, I've been a nurse for 35 years. I've worked in acute care. I worked in long-term care. I did home health for 18 years, and for the last 14 years, I've been with the Area Agency on Aging. So I have used Area Agency on Aging services over the last 35 years of my career. And so when I get a little passionate, just tell me to calm down a little bit. But Area Agency on Aging services very much so help people to stay in their homes and stay out of the more expensive realms of healthcare. The first item I'm going to cover is our senior centers. And I don't think that individuals realize how important senior centers are. We have approximately 450 senior centers across the state. And a senior center is a place for individuals to come for socialization, for a meal, for exercise, to just basically fulfill a lot of needs that they have in their lives. We get referrals for our senior centers from physicians that may have an individual that their husband has just passed away or their wife has just passed away, and they're worried about them socially. With families not being so nuclear, with children moving away, it becomes their support system. They develop friendships. They develop relationships with the managers at the senior center. So it's great for their mental health. We provide programs and education and trips. The exercise classes are wonderful. So you might not just be there for a meal. You might be coming for the exercise. I know my mother's in her 80s, and her and her friends come to exercise 3 or 4 times a week, and then they go and have lunch. But it's a great way to form those bonds. Health screenings. We screen blood pressures. We go over healthy diets. We can sometimes go over medications. Being a nurse, if they can meet with me with their meds, and we can go over their meds. Lifelong learning and nutritional services, like I said, and recreation. We sometimes have to, worry about fights at the pickleball courts, but we work through that. The next thing is non-care managed services that we have, and that would be the PA Medi and insurance benefit counseling. And you would be amazed how many people take advantage of that to go over to see what the best option is for them for their health care, especially if they're getting into some situations with utility prices going up, food prices going up. They may want to look to see what is the best insurance that can cover my prescriptions, what gives me the best copay for my physical therapy. And that is a wonderful resource that we have for the community. Volunteer opportunities. We use them in the senior centers. We use them calling our consumers to make sure that they're okay. So we use volunteers in multiple different ways. Transportation. to get to their doctor's appointments, to even go to get their hair done. And you may think, why does somebody need transportation to get their hair done? When you're 86, getting your hair done on Friday before church is very important to you mentally and socially. So if we can get those individuals to get their hair done and get something to eat and get back to their house, we've done a really great service to that individual. Emergency home delivered meals, legal assistance, senior community centers, and again, the Ombudsman program. And the Ombudsman program is where we have volunteers and staff that'll go into the long-term care organizations in our county. We have 41 in Butler. That would be your nursing homes, your assisted livings, your personal care homes, your dom cares, and your adult, your daycare, adult daycare. And what they do is they go and they advocate for the individuals that are in those facilities. They're kind of like the eyes for DHS and DOH. And we can go in there and kind of make sure that what's on that menu is what they're really getting, to make sure that the aides are treating them correctly, that their staffing levels are at the right level. So it's really on that ground level advocating for that individual. Now, it might be as simple as I put my sweater in the wash and I never got it back. But, we deal with that, and that helps them also. But it can be as much as I don't want to get my bath at 7 in the morning. I always worked 3 to 11, and I'd like to get it later, and we help advocate. But it can be up to very serious natures, too. So it's developing those relationships and bonds. We have the assessment services also, where we will go in and do assessment on individual to see where they are medically. And that determines if they're, not you need to remember these acronyms, but it makes see if they're NFCE, nursing facility clinically eligible. That would mean that their care needs are that of a level that they could be taken care of in a skilled facility, or if they're NFI, nursing facility clinically ineligible, and that would be in the community more. And it kind of sees what pot that they fall in, and we help help them navigate through that with a functional eligibility test to see where they fall. And then we assess for services, nursing home, the PACE Life program, supplement for personal care home, the DOM care, or community health choices. The care management services that we offer, and these are the care managers that we have at the aging office, and they provide what services we have. So we might be hooking them up with home delivered meals or in-home services. We educate them about the benefits that they do qualify, and we help with consumer reimbursement for supplies, service, even respite care. So that would be care management, personal care assistant, adult day services, home modification, in-home meals, and home support. Your next three slides are just the wide variety of services that we provide. So I'm not going to cover everything on there, but if you can see, there is a plethora of services that we offer to help support individuals to stay in their homes. And it's not a cookie cutter service. We go in and we look at each individual and see what services that we can provide to keep them safely in that environment. It may be a PERS, a fallen I can't get up button that may help them. It may be meals. It may be somebody to come in to help with their personal care, or it may be somebody to help with their laundry, with meal prep, getting their prescriptions filled, filling their prescription bottles. So if you look, I'm not going to go over each one because there's a wide variety, but these are all the wonderful services that we do provide. Two of them that you may not think or may not come to mind are we assist with the tax and rent rebate program, and that's going on right now. We're going out to all the senior high rises. We're going to the senior centers. We're going to libraries, to the mall to help people with their property tax and rent rebate, and the farmer market voucher program. We have almost fights and lines for farmer market vouchers. That's a very important, they love to get their fresh fruits and vegetables, and coordinating that with the local farmers and with the seniors that we serve. The options program, just a brief overview. You have to be at least 60 years old to be eligible for the options program. You need to be a resident of Pennsylvania, a U.S. citizen or legal resident, and you have to be experience some degree of frailty in physical and or mental status that impacts your daily function. So that could be just some assistance with getting your personal care done in the morning, or it could be helping assistance getting your medications filled and taken correctly. It could be individuals may not also receive medical assistance, long-term care, and the option services at the same time, and we're funded with Penn Care lottery dollars. Option services could be adult day services, which are are very good for those working, taking care of loved ones in their home, or for individuals taking care of their spouse at home. I always say, throughout my years of experience, there's been numerous times that I see a care receiver outliving their caregiver. And so we really try in Butler County to support that caregiver, whether it be some emotional or physical respite. You just take a few hours, go get your hair done, go to a Bible study, go meet with your friends so that they can rejuvenate to go back to take care of their loved one. We have a case in Butler right now that we're really trying to support the caregiver, because if that caregiver the care receiver outlives the caregiver, it's very difficult at that time for us to place or to move that individual that's receiving the care. Care management system services, home delivered meals. A meal is not just a meal. I mean, to go out there and to eat, like they need the nutritional nourishment from that, but also the camaraderie of somebody delivering that meal, of being able to have the independence to eat that meal at home. The personal response system, those are the fall and I can't get up buttons, personal care. And we have services where we can do consumer reimbursement for services they may pay for in their home or supplies, home health, home modifications, such as a lift chair or a ramp, grab bars in the bathroom, home support, and medical and equipment supplies. Right, back to you, Rebecca.
There we go. This is our guy that I mentioned earlier, and this gentleman or lady reached out to the AAA and said, "Oh my goodness, I need help either for myself or for my loved one." And this is the process specifically for Medicaid services. We understand that there was a specific question about this, so I wanted to take a couple minutes to talk through this graphic. It's a simplified version. If you all remember the How a Bill Becomes a Law, very sort of linear, and this is like the How the Bill Becomes a Law. Reality is a little more like the reality of how a bill actually becomes a law. But this is kind of the textbook version, and hopefully it will help clarify a little bit more about the role of AAAs in this process, as well as just the role that your constituents may need to go through if they have questions. This hopefully will help explain it a little bit. So somebody may call the AAA and say, "I need help." The AAA can ask them a few questions, and if it sounds like maybe this is a situation that might be appropriate to receive Medicaid-funded long-term care services, so this would be like the CHC, the Community Health Choices, or the LIFE program, then the AAA will then move on, and there are multiple organizations and groups involved. If you look at the key in the bottom right-hand corner, you can see the color coordination because, of course, it's not a simple process. The orangish yellow kind of a color is actually the independent enrollment broker and their role. The green circle, it's actually on the far left, is the financial side of things. That's the county assistance office. And then the blue is where the independent assessment entity, which really is your local AAA, is involved. So to go through this from left to right, you've got the box around the paperwork. The IEB is helping the individual complete the paperwork to go through the entire enrollment process. In order to be eligible, you have to be eligible clinically or functionally, and you also have to be eligible financially. So the county assistance office will take the paperwork that you've submitted and determine whether you financially qualify. The Area Agency on Aging is going to go into your home and do an assessment, a functional eligibility determination is what it's called, to figure out if your, Beth's acronyms a few minutes ago, NFCE or NFI, whether you qualify for the kinds of services that you would be receiving if you were in a nursing home. So once you go through that process, we know that you qualify or you don't qualify. Let's start at the bottom box, sort of in the middle, not eligible for medical assistance, whether it's clinical or financial. Then you can be referred to the Area Agency on Aging. And they're the ones who'd be able to help you figure out, what program might be best for me. Do I need options services? Do I need, maybe I just need a ramp. And that is the difference between me staying home or going somewhere else, losing my home. So the Area Agency on Aging is where you would go if you are not eligible for MA. You cannot receive medical assistance and receive services from the AAA other than protective services. They are two separate funding sources for the most part. Again, this is sort of trying to be the textbook version. Now, if a person is eligible for medical assistance, they then have what's called choice counseling. Sometimes people call it options counseling. I know when I first started working at P4A, I knew about the options program, and then there's this options counseling. I thought they were the same thing. They're not. That's why they've tried to change the language to call it choice counseling, but really they're going through your options to say, what is it that you want to receive? So the independent enrollment broker, when they find out that you're eligible, then goes into your home and explains to you what it is that can come next, what you can choose from. And you have two main options. One option is to go to the LIFE program. The LIFE in other parts of the country is also called PACE. And then the other option is going through into a managed care company, an MCO. The managed care company, or MCO, is what you will hear as community health choices. Right now, we have 3 MCOs. That may be changing in the future, depending on what happens with some procurement that DHS is doing. Primarily, if you're in a LIFE program, you're going to be receiving services in your home. And I know the purpose of this meeting isn't to talk about the LIFE program, but really the LIFE program is where you can receive all of your medical care, your specialty care, all in one place. So it's very coordinated. And then you're also living in your home. So they may bring you to a central location. You can see your doctor, you can see your podiatrist, you can get your medications, and then, they'll bring you home. With the managed care company, again, you have choice of 3, and the managed care company that you choose will, depending on what you qualify for and what you choose to have, you can either be in a nursing facility or you can be in your home and receive services in your home. So that's kind of a high level, as I said, overview of the role of AAAs in this process, and kind of a really brief 101 of the process that you go through in order to get access to Medicaid-funded long-term care services. Anytime, if anybody has questions, you're always welcome to reach out. I'm happy to explain it further. Like I said, it's not always quite as clear-cut as one would like it to be. Beth?
All right, I got to start off with the fun part of the presentation with senior centers and all that we can do there that's kind of rewarding and fun. And I'm not saying that older adult protective services can't be rewarding, but over my 14 years, the need for older protective services has increased greatly in my county and across the state. And to me, that breaks my heart. And there's numerous reasons for it, but the cases that we get, when I started 14 years ago, we'd have about 30 to 35 reports in need a month at Butler County. And I think when I left on Friday for January, we had just about 120. We had 118 reports, and I'm not sure what maybe came in at that night before midnight. And they are very complex and very, very troubling, some of the cases that we get. So as the area agency on aging, we invest reports of need. And a report of need is, we have mandated reporters, and there's confidentiality when a report of need comes in. And whenever we get a report of need, they come into 3 categories. It's going to be emergent, where we go out right then, a priority, where we go out in 24 hours, or non-priority, where we have a little bit longer to go in and see them, or it can come in as a no need. The types of abuse, we can have physical abuse, sexual abuse, emotional abuse. It could be neglect, caregiver neglect, or self-neglect, financial exploitation, and or abandonment. The investigation, when we go out to investigate a case, we will then substantiate the case or unsubstantiate. So substantiate would mean that yes, this did occur. Unsubstantiated is that we can't rubber stamp.
Sure. So like when you're looking at case determination like that, we look at preponderance of evidence. So substantiation is there's enough evidence to tip the scales 51%. Unsubstantiated is there's not enough evidence to establish that whatever the allegations are. And also we look at totality, We don't just look at what the allegations are. We make sure that there's not financial exploitation, abandonment, any of those items when we go in and look at our cases.
There. After finding the need for protective services and completing the assessment, we develop a service plan, a recommendation actions that reflect the least restrictive. And we look at the least restrictive way to take care of that individual in their home. So let's say that it was caregiver neglect and the daughter wasn't, let's take a case from Butler. Whenever they left for work, they tethered their mother in the basement because they didn't want her wandering outside. And they thought they went in front of the judge that I tethered my mother to make sure she didn't wander outside. We ended up, that daughter-in-law was no longer allowed to take care of her. She went to live with her other daughter, and we provided adult day services and hourly care so that individual, at least restrictive, was still with the family and had supports. It's just, we go least restrictive. We don't jump to taking away rights. We don't jump to that next level. We really look to how we can meet that person's need in the least restrictive measure. And we promote self-determination and community of care. We really try to take that individual's what they want and what they are asking for in their care, especially when it comes to self-neglect type cases. Sometimes, and sometimes, I mean, I went really to the drastic part of the lady getting tethered, but sometimes you have an older couple and that wife is doing the best that she can to take care of that husband. And we really look at those cases of whether is it abuse, is it neglect, or they just need some support in their homes to help her to care for that individual a little bit. I always tell you, when you have a couple, one usually is mentally good and one's physically good, and together they're whole, but one of those parts start to falter, we have to kind of step in and offer some support. There is a statewide elder abuse hotline to call, and they can also call our office directly to make a report of need.
And just to throw in there too, when we're looking at abuse in Pennsylvania, the whole Commonwealth, the most commonly reported and substantiated type of abuse is financial exploitation. That has changed in the last 2 to 3 years. Prior to that, it's always been self-neglect since the inception of this law, which is like in the late 1980s. So that's really drastically changed. That's something to really consider. There's a lot of that happening. Everybody probably has scams themselves that they hear, all the different things, but that's really has changed the dynamic of our elder abuse system here in Pennsylvania.
And going back to the financial scams, these individuals, you would think, we do education all the time, and you would think that I would never fall for that, but they do. They get coerced in numerous ways to be financially abused, whether they get the phone call that their grandson is in trouble and please send money, or I was dealing with one on Friday that she said that I need to send them these numbers from a gift card because they're going to send me a box of cash that's going to help me pay my rent. And we could not get her to realize that was a scam.
And I think that really plays into why senior centers and some of our other volunteer activities are so important. What happens is people get isolated as they become less and less independent. And so then if they don't have people visiting them there, sometimes what happens is people prey on them in these situations. And that's why some of the other services, if we can put funding into those services and prevent them from being isolated like that, then hopefully it prevents millions and millions. And actually, I think it was $2.2 billion they estimated last year was scammed out of Commonwealth, Pennsylvania, 60 and older in our state. So that's just, I think, a really important factor to think about.
And when it comes to financial scamming, at least in Butler County, we work very, very closely with the state police also. They have a very robust program to go out and to educate the stores about buying the gift cards. They will go out to our senior centers and do numerous presentations. They have been very helpful in helping to reduce the financial scamming or attempting to reduce it. Again, the Ombudsman, I kind of already covered what the Ombudsman program does, and I know we're running short on time, so if you have any questions about the Ombudsman program, please give us a call, or any programs at the area agency. We'd love for have you come out to any of our centers to see what is going on, and Rebecca will.
And I get the statistics again. I'm the bookend with the statistics, and you won't be surprised at what I'm going to talk about next. It actually has something to do with what's going to be happening tomorrow. A little bit of history. If you look on your slides, it's number 28. There is a graph that is showing from 2010 The blue is the increase in the number of older adults that we are seeing. So you can see it's going up from left to right. And then if you look at the green, that's the amount of state-only dollars. This is lottery dollars that go to AAAs. And that the trajectory is going down from left to right, going down. They're going in opposite directions, which is concerning. We've talked about the wealth and variety of services that AAAs provide to older adults. When a AAA has a volunteer and they go and they drop off a meal and they see that somebody's not getting their mail, that's a sign something's going on. They call the case manager and they say, hey, I saw somebody, this is the situation. The AAA can go out quickly and see, oh, they're not doing so well. When they come to a senior center and maybe they're disheveled and they've never been disheveled before, maybe it's a sign that maybe we've got something going on. Maybe there's dementia going on. Maybe there's, something is happening. When you're able to provide those services sooner, earlier, you're able to either identify issues like abuse and neglect and all of those things, or you're able to prevent them in the first place. If we can support the caregivers adequately, if we know that husband and wife, the example that Beth was just talking about, and the wife is trying to support the husband, if we can connect with her and provide her assistance, it won't get to the point where somebody sees and believes that there may be neglect going on. That's the purpose of area agencies on aging, and that's where the funding comes into it. And it's not a fun discussion. I know you're getting, hit all the time with people asking for money. You're not, well, some of you may be on the Appropriations Committee. I know that's not the purpose of this meeting, but I did want to give you a little bit of information about what's happening. And I did a comparison, an analysis of pre-COVID to now. If you want to go past COVID even earlier, then you're looking at even more funding that actually would have been needed. But if you just look at pre-COVID to now, 2018-19 fiscal year, we all know how much things have increased as far as cost. That's the same for all of the AAAs. In-home care has gone up dramatically. Meal delivery has gone up dramatically. Go buy eggs. How much more do your eggs cost now than they used to? AAAs are implementing waiting lists, increasing waiting lists because they don't have the funds, and we've got increased personnel costs. My health insurance for my organization goes up every year. It does for you too. It does for the area agencies on aging. Last year, we did a survey to find out, well, actually it was this fall, to find out what the impact has been of funding and the fact that there was no additional funding in the budget last year for AAAs. 92% of the AAAs responded that they're facing a budget shortfall this year. And according to the survey, and actually it's probably a little bit worse even now, they're looking at about 40 senior centers closing this year and eliminating approximately 100 programs across the state. They are looking at reducing staff hours. They're looking at not filling vacant positions. They really are looking internally to do as much as possible and spread their staff as thin as possible in order to make sure that older adults are getting the services that they need. So it really is a critical component of this. On slide 30, you'll see the inflation just from pre-COVID to now, 28.28% inflation that all of us have felt. We have an increased population. You saw that graph with the blue. It's dramatically increasing. If you just control for inflation and the increased population, we would need an additional $105 million just to serve people at the level that we did in 2018, 2019. And then beyond that, every year between now and 2030, we estimate that you would need an additional $12 to $15 million just to keep AAAs at the level they were in 2018, 2019. And if I were sitting here in front of you before in 2018, 2019, I wouldn't be telling you that they were fully funded then either. So I know hopefully you've been hearing from some of your area agencies on aging and some of the older adults in your communities and in your districts. Hopefully you'll be hearing more from them. And I wanted to explain a little bit about what it is that you'll be hearing from them and the importance really of this funding. The funding comes through the lottery. It goes to the Penn Care line item. And what we're asking is that you support our ask of $105 million. We know that that's a large ask. We could ask for less, but we thought it'd be best to just share our need. We also are asking that you reach out to the governor's office as well on behalf of your constituents to say that you support increasing funding for the area agencies on aging so that they can support older adults themselves. And then also, we are asking you to think about if the legislature and the governor decide together that you are going to be doing some kind of legalization or regulation of skill games, if you would consider putting some of those funds into the lottery fund. Those skill games are competing directly with funding that's going into the lottery. And if there are questions about the solvency of the lottery, the skill games is one way that we can help address that. So we would ask that you consider that if that is a decision that's made. I know that there's some interest in potentially legalizing and taxing skill games. I think that's about everything. I do want to point out that in your packets, you should have this 2-page document with lots of colors. It's basically talking about what I just talked about. If you have additional questions, you can certainly look at this. You're also welcome to talk to me or Beth or JR. Our contact information is on the last slide. And we welcome the opportunity to talk with you. And really, if you take nothing else away from this discussion, go visit your area agency on aging. See the good work that they're doing. Go and, say hello to your constituents and see firsthand how important these area agencies are. I guarantee you our AAAs would welcome you coming out with them and visiting.
If you're having a bad day, go to a senior center. I'm just telling you, the history, the stories you can hear from the individuals that are there, you would make their day and they're going to make yours. I mean, they are so grateful for the services that we do provide that it gives me goosebumps to think about. I mean, the older generation is what made Pennsylvania what it is today, and we really need to support and to help them navigate their aging journey. So please go and see them, contact your area agency on aging, and we'd even take you on home visits, and you can go, visit people in their homes and see what we deal with on a daily basis and the wonderful good that those dollars do to individuals.
Thank you all so much for that important testimony. I'd like to recognize that Representatives Kruger, Eric Nelson, and Harris have joined us. You'll see people coming and going. Of course, there's many committee meetings, and we all have different obligations, so I thank them for being able to make it. So you answered my first question was, what were the devastating effects of not funding our AAAs in last year's budget? Thank you so much. And thank you for all this important testimony. In my office, we actually have someone from our AAA come every month, and we schedule appointments for folks who are about to turn 65 or become eligible for the services, and we show them everything that there is for them. And we do have senior centers in the building in which my office is, and it is fun to come and visit on a crocheting circle or, when they're just doing crafts and chatting and having lunch. They really do appreciate it, so I thank you for that. Do we have any questions from any of our members? Chair Menser, would you like to ask a
couple
question?
of our members have questions, and then I'll have one after they've had a chance to ask theirs.
Okay, sorry, I took the sheet. Representative Schlegel?
Thank you, Madam Chair. I think you've kind of alluded to a response to my question, but I'm going to ask it anyway, if you could highlight it. And I'm particularly fond of a program in Lebanon County that I had a chance to visit recently, and that's the LIFE program. But in a broader sense, could you highlight a little bit what happens when an individual comes into one of our area offices and they indicate that they require services, they need financial assistance. Can you talk a little bit about that process and how that information is disseminated to them? And part two of that question is, do you immediately check for eligibility for medical assistance?
That's a great question. So basically, as was alluded to in the slideshow, a lot of what area agencies on aging do is information referral. Because a lot of times people don't plan out stuff. They come to us like what I call in crisis. Mom, I came home, visited for Christmas. I go back home. I'm a little bit worried about my mom, so I call the area agency on aging to see what kind of help I have. They go to the hospital, something happens like that. So what happens is we take that information that comes in and we will talk to that individual or that family member and kind of try to sift through what's going on and what kind of assistance they have. If they look like they need to be in the system and get our services or get Medicaid services, then we will do that assessment process that we talked about that Rebecca laid out in that slide that had all the different stuff. So that at that point, that kind of tells us which way they need to go. Do they need to go into Medicaid, or do they need to stay with the Area Agency on Aging, or have other community resources that we might link them to help them in that process? So it's kind of like each case is case by case, and we are very specific and try to really help and drill down on what is necessary for those individuals.
Thank you very much.
Thank you. Representative Kruger?
Thank you so much, folks, for joining us today and for your testimony. Last week, when there was an announcement about a federal funding freeze in my office, we got a lot of calls about Medicaid and a lot of calls about Meals on Wheels. Now, I understand that 2 judges have temporarily stayed that, but there's a lot of questions right now. I know how important Medicaid is, and Meals on Wheels is serving the seniors in my district. Is there anything that you think we should be doing right now at the state level to try to protect those programs?
Fortunately, we do have a pause, at least while some things get figured out. I think one of the big things, and this may not exactly be the answer you're expecting, is to be calling the folks at the federal level to say how important the services are. Older Americans Act is the enabling legislation that created area agencies on aging, and the funding flows through that. So while the federal government is taking a look at all of the different funding that goes out in all of the programs, ensuring to them the importance of continuing to fund the Older Americans Act, and also ask them to gosh, I'm blanking on the name, but they need to reauthorize the Older Americans Act. And aside from that, really, it's checking in with your area agency on aging to see what's happening. We are fortunate in Pennsylvania that we do have a lottery fund. We are not solely reliant on federal dollars in order to provide services. But at the same time, again, the funding is not adequate to meet all of the needs. I don't know if either of you have other thoughts.
In Butler County, we get about $5 million a year for our budget. 20% of it comes from federal funding, so a little over 200,000. We are very lucky to have the Penn Care dollars that we can support and continue those programs. And at our county level, even when that came through, we were going to continue to provide the meals to provide those services. So I would say just to continue to advocate at the federal level of how important those dollars are.
Thank you. Yeah, we've been capturing stories from the folks who call and sending them right to my Congresswoman's office.
Representative Labs?
Thank you, Madam Chair. And I just want to thank all of you for your testimony today. The services that you provided are so important, the services that these agencies provide. We work very closely in my office with our local area agency on aging. So it is a very important topic for our aging populations in our district. So my question is more kind of logistics in terms of some of the options that folks might have. So if someone is eligible for medical assistance, they've been deemed eligible, to what degree do you provide information on the LIFE program and the MCOs?
I can start out and then, excuse me, and then my colleagues can certainly jump in. The AAAs will provide broad information. The point where folks are making that decision and choosing which direction they want to go in once they find out that they are eligible, that responsibility is held by the independent enrollment broker. That's what they do when I was talking about the choice counseling, they're the ones who really kind of explain the difference. Now, AAAs will definitely explain, especially if they ask those questions. But really, it's technically the job of the independent enrollment broker to do that. JR, were you going to add?
No, I was just going to say the same thing that you were saying. The independent enrollment broker, which is Maximus right now, that's their role in the whole process. But prior to getting to where you to an eligibility, the AAA will give counseling, INR, information referral if the families ask or the older adult asks, or they'll explain the process to them. If there's problems, oftentimes, sometimes there's issues with getting enrolled and not getting the proper paperwork in because it's a very onerous process. Then sometimes they'll come back to the area agency on aging and we'll do different things with them to try to help them get through that process so that they understand it and they get the right paperwork in and things that they need to be eligible for Medicaid.
Thank you. And so just to clarify, the brokers are picking up at the point where the decision is going to be made. That's when their involvement begins.
Yeah, when the IEB hears that the person is eligible for medical assistance, that's when they go out in the home and talk with the individual and say, all right, these are your options that you have. You can go to a life program or you can choose a managed care company and you kind of go from there.
Okay, great. Thank you.
Okay, next we're going to have questions from Rep. Kozarowski, then Rep. Harris, and Rep. Stair.
Thank you, Madam Chair, and thanks very much for all of you for being here. And just on a side note, in terms of funding, the Secretary of Aging lives in my neighborhood, so whenever I make eye contact with him, I'm well aware of what he's going to ask me, so I dodge him at all times now. But we're really lucky to have Jason Kavulich, a Scranton native, to run the department. So, but my question is, I'm a huge advocate of being able to age in home. I am also a registered nurse and sent a lot of patients back home that ended up having challenges because the rug wasn't to the floor and they went back with a walker and they had orthopedic stuff done. So what is the biggest challenge, do you think? Meeting like that checklist that patients have to meet the eligibility, or is it actually the workforce, the direct home care workers that are able to, because there's all different levels. I mean, you can have just a check, like just a couple activities of daily living that they need, but I think in the long run, for all kinds of outcomes, being able to stay in your home and be safe in your home and be able to age there is much better. There's some people that can't. I mean, we know that sometimes the facility is necessary because of the level of care they need. But really, what's the biggest challenge to be able to stay in your home?
I think you hit on two very important things. One is the checklist, like is my laundry in the basement, or is my home able to have be equipped for me to stay there. But the direct care worker shortage right now is hitting us and Life and the MCOs all equally. I mean, it's very difficult to find direct care workers. And that becomes very hard for us to keep the individual at home. So yes, it is getting that home to that level, but then finding the qualified individuals to come in to take care of them. Did that answer your?
The other thing, if I can jump in for a moment, is to try to get folks early, as soon as possible. Don't wait until you have that, oh my goodness, what are we going to do? Mom needs help, dad needs help. It's getting that information early as possible.
And with that, you got to think about Medicaid's probably one of the biggest line items in the state budget. And so if we get people into the system earlier and get pen care items, we spend a lot less money on individuals as an area agency on aging. And if we can get them in our system and have the funding to do that, it prevents them from going on to Medicaid for a longer period of time, because either they're going to a senior center and they're having those touches and stuff like that, and they don't have to leave their home and go out. So I think it's really important that we fund the entire system, not just the Medicaid piece of it, because the preventative piece that we do is so vital and can keep so many more people in the home and can be very cost effective in the end by investing in it.
If you don't if you don't invest in this level of care, whether it's preventive or offering the information referral services, offering them those services to adapt their home, you're going to fund the most expensive model. And for just lack of round numbers, and our care plans are never this much, so don't look at me like, what am I saying? I'm just saying in round numbers. If I can build a care plan for $1,000 a month for somebody and get them their meals and get them a little bit of support with their personal care, changing a bed. Do you know how hard it is when you're 80 years old with balance issues to change your sheets on your bed or to get your stuff in and out of a washing machine? I mean, sure, you need help with your personal care, but you also need help, just doing some items around the home. If I can have $1,000 to keep them in that home, that's keeping them from going into the medical assistance realm where you're going to be paying anywhere from, $4,000 to $7,000 in an assisted living, up to $11,000 to $15,000 in a skilled facility where they might only need $1,000 of supports to stay in their home. We can wax and wane services. Like you said, being a nurse, when they go into the hospital, when they come out, they may need to pop up with our services a little bit. After we pop them up, we can bring them back down to keep them in their home or to talk about their options. And what I mean by that is they may be living in a 100-year-old farmhouse that their grandmother owned, but we may be able to talk to them like, hey, to make this feasible for you, we really can't, but look at these senior housing that we have in town that we could move you to where there would be friends. So we help them move to that level that they're not having to go to that more expensive level. So it's really developing that relationship, talking to individuals, and funding that support they need before it crashes and you need to give them thousands and thousands of dollars.
Well, thank you. And we look forward to working with you. I haven't heard the word care plan in a really long time. The nursing care plan. No, we have to put the care plans together. I think Governor Shapiro should just listen to the nurses and we'll figure this whole thing out.
Thank you. Rep. Harris?
I plead the fifth.
Well, let's do the rent rebate one first, if you don't mind. And I can only speak from Butler County, and I do know that we go into the housing authority buildings and those senior living apartments, and we help them with rent rebates. I'm not sure about the exact building that you're talking about, or what it falls under, but we do go to those facilities and help with rent rebates. So I would continue to investigate that on your end because I would think that they would qualify for the rent rebates, but I don't know. Right. When you're getting to the direct care worker, and I would just, I think the workforce pool is shrinking, that we don't have as many workers. I don't have any data to support that. I mean, I'm just a nurse, but the other thing is if you look back 10 years ago, you didn't have a Sheetz on every corner. You didn't have as many businesses, as many fast food restaurants, as many other organizations that are pulling from that workforce that you have that are paying very, very well. And the problem is when you get into the nursing facilities, they get paid an X amount. So if you have to up the aides to the aide salary to compete with Sheetz down the road or whatever business, I'm not picking on Sheetz, I eat there all the time, but I mean, then you have to up the med tech, then you have to up the LPNs, and you have to up the nurses, and you have to up the dietary, that they can't afford to do that, which makes it makes it very, very difficult. I think getting people at a younger age interested in healthcare and seeing the rewards of that and seeing that they can build a career out of it would be very beneficial. But there is the direct care worker shortage impacts at that level and at the home care level. Did that answer your question? Okay. Okay.
Thank you, Rep. Nelson, and then Rep. Khan.
Thank you, Madam Chair. And I agree, part of that worker shortage, I think a good first step, if we restored the work requirements for able-bodied adults. You know, there's 170,000 able-bodied adults, no kids, they're not caring for anybody. They could work 20 hours a week. They're supposed to under federal rules, but Pennsylvania has been waiving that work requirement, and so they're sitting on the couch instead of, you know, helping people off their couch, you know, which was a good thing. My question is trying to understand the lottery fund balance, and I have lots of notes from your testimony, and I really appreciate the I'm just a bill pathway, you know. So that pathway, last budget, you know, because the lottery fund is generating over $1 billion a year, but it seems like we in Harrisburg, in a bipartisan way, have gotten into this habit of transferring monies from the lottery fund for other things. And so in your graphic, it talks about, you know, the MCOs, but also the pen care, because I think it's like there's almost 375 million of that billion getting directed to other things. So what would that mean if we're able to kind of reprioritize lottery funds just going to seniors? Because it seems like we're kind of getting double and triple dipped here.
They're both looking at me. Absolutely, you're right. It's almost $400 million a year that's going. If you look, it's roughly the same amount that's going to pay for the AAAs. And so, you know, not taking that money to use it to support Medicaid absolutely would be a huge impact. That $105 million would easily be covered if we were able to see lower amounts going to pay for Medicaid and the long-term care system there.
So, you know, frustration. Oh, go ahead.
I was just going to add to it, like, for instance, in last year's budget, this was a one-time only, but they did take $25 million, I think, and gave to skilled nursing facilities out of the lottery. Not saying that that doesn't benefit senior citizens, but again, we gave $25 million there, and the area agencies on aging got no increase. We were pretty much flatline budget. So I think that's where we've got to really look at how are we utilizing the lottery, like you're saying, and which ways are we spending it. And I think in my opinion, we're driving it towards the higher cost things in Medicaid. And if we keep pushing everything to the Medicaid system, it's going to be more expensive, and there's a lot of easier fixes if we invest and we take the time to look at, like you're saying, the lottery. It is very profitable, and it has, you know, they always give conservative estimates on it as well. So I really do believe that it has the viability to invest in these things, but we do need to, I think, look at how it's done and how we do it. And I really want to advocate that area agencies on aging really need to continue to be funded, because we're the bedrock, the basis of our aging system here in Pennsylvania.
Yes, and Mr. Reed, you were saying that, you know, you had touched on the preventative side, a lot of those. I'm on a PROP, so I was pulling up that chart and looking at different line items. You know, I share that frustration. We did $3.7 billion in new spending in Pennsylvania, and we flatlined seniors across the board. There's 2.4 million in the state, like way more than our high school students. So if we only funded the pen care line item, then we would be missing the boat on a lot of those preventative services that are down there. Or does that meet the need and we're good to go?
Yeah, so if you gave it to the pen care line item, that's the money that goes to Pennsylvania Department of Aging, gets distributed to area agencies on aging to hit those preventative services that we're talking about. Medicaid's a different line item. Now, out of the lottery, as you said, every year for, I forget how many years it is, there's $300 or $400 million that are taken out to give to the community health choices, the Medicaid portion of it. Last year, I also pointed out there was $25 million that was taken out of the lottery and given to skilled nursing facilities. All those are necessary services, but I think we got to not make sure that we are not funding the preventative stuff, the first line of defense, which is the area agencies on aging. And as you said, our population now is 25% of our population is 60 and over right now. In 8 years, it's going to be 33%. We are in an exponential growth area. This is the time right now that we need to invest in our older adults in Pennsylvania and in the Penn Care line item for area agencies on aging for us to help prevent and to navigate everybody through the system.
Thank you. Thank you, Madam Chair.
Thank you. Rep. Khan?
Thanks for your testimony. Just two short questions. One, working with Rep. Marcel on a bill for assisted living to get that covered under Medicaid in Pennsylvania. Currently, it's not. It's just those long-term care facilities that are covered. And just wanted to see if y'all had a sort of a take on that, because you mentioned these facilities, the long-term care facilities. I thought that would be helpful for older adults.
I think that assisted living and personal care homes are an essential piece of the puzzle, if that makes sense. Because sometimes we just can't provide everything in a home that somebody might need. They might need that next level of care. But being that they're not covered under Medicaid, you have those individuals. And let's take Medicaid out of it. Can we take Medicaid out of it for a minute and just kind of look at it normally? If I have somebody in their home, and let's say she's a widow, her husband worked at Cleveland Cliffs, the steel plant in Butler, she stayed at home, and she is getting about $2,300, $1,800 to $2,300 a month on her pension, Social Security. Okay, but she doesn't quite qualify for Medicaid. She's in her home, and we have to put her in a personal care home because we just can't meet her needs at home cost effectively. I can't find a facility in Butler, a personal care home that's under $4,000 or $5,000 a month. Even if I could get that she could have the Social Security supplement, I might be she wouldn't qualify that. Let's say somebody's lower income. I'm getting them up to maybe $1,200 or $1,400 a month. Where do you put them? Because all the personal care homes and assisted living that we have won't take that level. So having some degree of assistance at that level, it's far less expensive than putting them in a skilled facility. So I do support that. Our goal is to keep them at their homes. Sometimes that cannot happen, but I don't know why we're just then jumping to the most expensive. Why we don't go to that medium, that next level. I mean, that's against what I do, but we do what's best for everybody. But I hate jumping to that more expensive model when we don't have to.
And I'd add to that, just like we were saying, being fiscally responsible. I think we need to look at that as well, because it goes right to the argument that I'm making. Let's fund the area agencies on aging for that first level, but if they need to go to the next level because we can't sustain them in the house, it's cheaper to go to fund assisted living and personal care homes at a cheaper level than it is the skilled nursing facilities. I think that's the whole continuum that we need to really look at as our older adults age, and it's a huge, enormous budgetary issue, I think, for the Commonwealth.
Thanks. My second question and last question is on the senior centers. There's one in my district. There's also one there's a few right outside of my district that people in my district go to. And you mentioned that I think there's going to be 40-some closing this year. And given the fact that older adults use these facilities daily and they're going to be having no option, can you tell me, first of all, are they still... I'm sort of a leading question. But can you tell me why they're needed now? Let me rephrase it. Why are these senior centers still needed? And also, what are these seniors going to do? These older adults going to do when their facility closes? Thanks.
Yeah, that's a great question. So, yeah, senior centers do a lot of different things. They're like that first level in the community where people can come and connect. The connectivity, I've got to point out, is so important. Like, when you do studies and look at studies out there, one thing we can learn from the pandemic is we socially isolate, we cause all kinds of mental illness, mental health problems, all kinds of different things. People lose their independence, at home even greater, and then they end up in a facility and higher levels of care. So community senior centers are great because they're connectivity spots where we can go, we can connect with our neighbors, we can do activities there, we can do exercise there, we can have screening there, we have a meal there. So that's why they're so important for people to get connected and us to continue to fund them, because they're that place for our older adults to come and do that. And so that's really, I think, the need of that. If we can't fund them and they close, then what ends up happening is you end up having to transport people further distances to a senior center in your area. For instance, I know we're looking at closing at least one in Lehigh County. So then when we go to look at that, we will have to move them to other senior centers and see if that's viable for them. And unfortunately, sometimes then what happens is they lose the ability to have that kind of connectivity if we can't serve that area of the county. We don't have the kind of funding to do that. Then we have to look at other services like home delivery meals or other things that might be not, that might help, but they're like the senior center is probably the core of what we really need to make sure we're funding so that we have accessibility for all our older adults in our communities.
Plus, the senior centers offer another level of assistance to individuals. So let's say I'm going to the senior center. I'm older and I'm going there. I may notice two other individuals there that I could help get their groceries, or I could help take them to the doctor. So they're becoming a volunteer, but they're like almost helping somebody. It gives them a sense of purpose. And when you lose that sense of purpose, your mental and your physical health go down. So it's developing that community and really being able to help that they can help and support each other. So they're vital. In Butler, we have looked over since I started, we had 11 senior centers. We're down to 7. We really look, instead of closing them, do we lower their days? Do we lower the hours? Trying to stretch those dollars as much as we can to keep them open. But they are a lifeline to many of our seniors, and we get many questions and many referrals that we get out of that environment.
And go ahead. If I can also add, it's again, the AAAs are making really difficult decisions right now. They don't want to see senior centers to be closing. And unfortunately, because of the fact that we're not able to serve them early, we see them in protective services, for example. I don't know, Beth, we were talking earlier, if you want to give your example of how much, was it, or maybe it was JR, forgive me, how much money is going to pay for protective services. And when you're trying to decide, do I help somebody who's in crisis, who's being abused or neglected, or do I keep the senior center open? I mean, it's like you have to triage. You have to make a really difficult
You look at what's going to keep you out of the paper, to be honest. I think the senior centers are good, but when I'm looking at my protective services, I have doubled the staff of my protective services in the last 14 years. Actually, in the last 5 years, I've doubled my staff. I've added clerical to it because the needs are so complex at that level and take up so much time that I have to funnel so many resources at that level. But again, it's like I'm putting the fire out when I could have prevented the fire. So that's why these preventive services, such as the senior center and the home services, are so important. Because when I'm cutting those, when I'm not able to put as many meals in a home, when I'm not able to have the senior centers open as much, that increases the risk of having the PS cases, which are very expensive, and I need to have additional staff, which is expensive. But just the resources to keep them safe is expensive. So I'm trying to prevent the fire than paying to put the fire out, if that makes sense. And with insurance going up and the cost of employees just going up, it's very expensive to double your staff and to not get funded. We're running at a $280,000 deficit this year in Butler County. We're doing everything we can to keep those services intact, but when does a point come that you can't stretch anymore? When does a point come where something falls through a crack? And our seniors don't deserve that.
I agree. Thank you so much. We have a question from Representative Jones virtually.
Thank you, Madam Chair. I really appreciate these hearings you're holding and a lot of great statistics today. I wanted to compliment the very opening remarks from our first speaker, just sort of celebrating our seniors, which we need to do. Our society does not honor and really take value from seniors. A lot of them have a lot to contribute that others do, and I appreciated those remarks. I do have a question, but if you bear with me a second, I've elected to stay on this committee. I'm in my 4th term now, and because this is so critically important, we have a major. Not only do we have a funding problem, at the root of it, we have a major demographic problem. And I love seniors, but you can't run a state on retirees. And our very prohibitive business policies we're just so unfriendly to business that the jobs and therefore the young people and the workers and the children of a lot of these folks and grandchildren are leaving the state. We got to get serious about being more competitive. The only demographic that's growing is the over, I think, 65 or 80 group. With that said, on funding, I think if those of us on the committee or and others are going to get really serious, and I know our 2 chairs are, I'm going to be as nonpartisan as I can be, but I really want to make this point. At a high level, and yes, there's a little money that goes into or comes out of the rainy day fund, but at a real simplistic but very important high level, we have to have a balanced budget in Pennsylvania. We spend all of the money we take in every year. Sometimes we spend a little more, sometimes we put a little bit in the rainy day fund, but largely a rounding error. There's a number of things we have to fund. We talked about social services, Medicaid, we've got infrastructure, so on and so forth. So here's the reality. If we want to contribute another $100 million to our seniors, which I think is money very well spent, as you have articulated, it's a great investment and ultimately saves cost. And by the way, we're not going to raise taxes. Whether you believe we should or shouldn't, it's not going to happen. I think it's counterproductive in the long run, but regardless of your position, that's not going to happen. So if we're going to fund $100 million here, probably should be $200 million. We got to figure out where that's going to come from. And we got to get real serious about where we're spending money. And I'm sure there's a number of examples that both sides of the aisle could point to. I'll point to one that gets a lot of bipartisan support. We already fund all of our state-owned universities over $500 million a year. That's our responsibility. Probably some room for efficiency there. But we, on non-preferred universities, Pitt, Penn State, and Temple, we give these are 3 universities with combined endowments of over $10 billion with a B. We give them over $600 million a year, despite the fact they're quasi-private, for all intents and purposes, they're private universities, semi-public if you want to call it that. We don't do that for any other universities. $600+ million a year. We could double your request from $100 million to $200 million. We could give, I've been trying to calculate, Madam Chair, how many nursing home workers and in-home care workers we have in Pennsylvania. It doesn't seem to be published. We could give 20,000 workers, 20,000, a $10,000 raise if we redirected another $200 million to support that. Let's make it $300 million. Maybe it's a few more workers than that. We could give 20, 30, 40,000 in-home care and or nursing home workers a $5, $7, $8, $10,000 a year raise if we took $200 or $300 million out of that 600. That's just one example, but the reality is, that's where I would start taking it. But we got to figure out where we're going to take it from, because there's no place to get more. We spend all of it, and we can't run a deficit. With that said, my quick question is, relative to keeping people in home, when we look at elder abuse, and for the sake of time, I'm going to include compensating spouses or other family members for care. If there was one or maybe at most 2 things that we could do legislatively, either through maybe more power to law enforcement, some banking rule changes, compensating spouses and others for taking care of their loved ones, what's the one thing each of you would do, one, legislatively, where you would change the law to either do a better job of protecting them from abuse and or keeping them in the home? Thanks, Madam Chair. I appreciate you giving me the time.
All right, well, that's a really good question. That's a tough question. I think one of the things that I know they're working on is the Older Adult Protective Service Act needs to be rewritten because of when it was written in the 1980s and in the change in the 90s, it did not have all the online banking and scams and different things like that. So I know there's been a lot of different push to try to change that. There's some working on it now that I'm aware of. I think if we want to save money in the protective service realm and scams, I think we need to get on board with banks and financial institutions to help work with us to make it easier for us to get records, to make it easier for them to stop these transactions that are going overseas to other places. I think that would be the number one place that I would say if we're talking about scams for us to try to change that. I would throw my support behind that as a legislative ask.
I agree with JR with the changes and supporting the Adult Protective Service Act and working with banking to help decrease some of the financial exploitation that we see, improving the communication between the two. The direct care worker shortage, I've looked at numerous models for that. And I mean, reimbursing family members to take care of loved ones, it seems like a wonderful concept, but we get a lot of PS problems out of that because many of the MCOs or that will hire family members. And that sometimes you have an older adult that they will sign their granddaughter's timesheet even though the granddaughter never worked. So I think it's a model to look at, but you really need to look at some of the accountabilities and some other options with that plan.
That's such a huge question. If I can have 1.5, if I can respond with 1.5, one would be
Fair enough.
Thank you, appreciate it. One would be the skill games. We do believe that it's significantly impacting lottery proceeds, and so if we could redirect some of those funds to support the lottery, that's one. The other, and I'll consider this my half. I think it would be really helpful. We have some national data that talks about the impact of, providing services like those that AAAs provide and how it can prevent more costly services. We don't have anything like that in Pennsylvania. I would love to see us have some sort of a study to be able to demonstrate that offset. If you were to spend more on the services that AAAs are providing, how long would it take to start seeing that? And when would we see, how much would we need to contribute, at what level? And I don't know who could do that, but that is something that I would love to see. Is it an LBFC kind of a thing? I'm not sure, but that would be my second small one. Maybe we could get some data to be able to demonstrate how to offset some of these more expensive services.
Thank you. And we're going to close with some. Sorry, Representative Jones, your time is up. We're going to close with Chair Menser giving final remarks. Thank you all for being here. We have folks waiting for this room.
Thank you. And I just have for coming today, and thank you very much for this chart. It was extremely helpful. We're all scratching our head, or not all, some of us are scratching our head, wondering why there aren't more people enrolled in the LIFE program. And basically, I'm wondering, you may not be able to answer this, but when they do go to Maximus, after you refer them and they go to Maximus, does Maximus use a set script or what? Have you ever seen their presentation?
I don't know that. I can speak from what Life has told me. So Life doesn't feel at times that their program is maybe promoted as much as some of the other programs.
Okay.
And from a nursing standpoint, I love the LIFE program. I'm not saying the MCO's program isn't as well, but if I have a needy individual that doesn't have a lot of family support, I really promote that LIFE program because they wrap them around and they really care about them, and they take them to the adult day. They make sure their medical appointments are done. Like they really care and do the best they can cost effectively to take care of that person.
Thank you for that, and that's what we believe.
Yes.
You must, though, have some people, after they go to Maximus, that come back to you because you're familiar, the AAA's familiar, and go, I don't know what to do. I mean, how do you handle that?
We do get that. We try to. I try to explain it, both options, without letting my my preference
Okay.
shine through that much, but I will at times give them like the numbers for each one to say, call and ask them, a little bit more about each program to help educate them.
One more quick one.
Yes.
Okay, if they're not in the LIFE program, they're CHC, and you have these services you have, and you have dollar signs by some of them, do you get reimbursed for the services that you provide them through the MCO?
So once they go over to the Medicaid system, we can't provide those services. The only service that an area agency on aging can give after they are eligible for community health choices is protective services. And that would be if there's abuse, neglect, exploitation that's occurring.
Okay, thank you very much, and thanks again for coming.
Thank you, everyone. This meeting is adjourned.